Hey, YouTube. It's Lee Car Tim here again. Um, in passing a little while ago, I mentioned that I have MS. Um, this is just a story about my struggle with the MS and a little bit of what I'm dealing with as far as the healthcare system and doctors and whatnot are concerned as well. Um, Back in February of 2006, I woke up with sort of numb-ish hands, tingling in my hands, especially my left hand. And what I also had was numbness and tingling like directly down the middle of my face and on the left side. Numbness, tingling, um, and it actually felt a fair bit colder than the other side, which kind of freaked me out too. Um, and on my left foot, I was getting numbness and tingling. That was actually the worst part of it. Was my left foot. Um, so I went right down to the emergency room and told them that I thought I was having a stroke or some kind of something along those lines. So they did like a ton of testing on me. Like I felt like a total pincushion. But they really wanted to find out if I was having a stroke like right away, and if I was having some sort of like a heart attack or something like that. So basically, at the time, I didn't have any health insurance. So um, what I did was, well, they wanted to do a CAT scan on my head, my brain, and I didn't have the $800 or whatever it was at the time to do it. So they basically said, "Well, see ya," and they just sent me back home. And so what I did was I went online and I did a lot of research and uh, you know, on circulatory system and you know, um, heart conditions, stroke conditions, that sort of thing. And I tried to incorporate a lot of foods that were, heart healthy type of foods into my diet. And about, I don't know, maybe a couple of weeks after that, it went away. All the symptoms went away completely. So, fast forward to this past, um, not this past, it would be 2010, October of 2010, no, sorry, September 2010. I had the exact same symptoms happen again when I woke up that morning in September. And so I went in again and I saw doctors and stuff, and they were like, they didn't really know what was going on with me, and it took quite a lot for me to, get, um, like authorization through the healthcare or through the insurance company to get an MRI. That was a big thing for me. I had like 4 or 5 different doctors saying this guy needs an MRI, and the insurance company was saying no, I don't think so. So that was a bit of a hassle. Okay, so um, then what happened was I finally got a primary care doctor, got on Mass Health, um, and basically saw my primary care doctor for the first time in I think it was late October of that same year. Um, and basically, at the time, I didn't have the symptoms going on. So, he was kind of like, you know, um, maybe it was just a passing thing. Sometimes these things happen to people and then the symptoms go away, and you kind of heal yourself or whatever. And I was like, that seems like a pretty drastic set of symptoms to just sort of come and go like that without alarming, a doctor, a primary care doctor especially. Um, like I went home that day, and the next day I had the symptoms start up again. So I called him and I told him, and he's told me, go to when you have these symptoms, go to the emergency room. And I was like, well, by the time I get there, most likely the symptoms will go away because for some odd reason, that's what they were doing at that time. I would get the symptoms, I'd wake up in the morning and get them, and then, maybe half an hour, or whatever, they would go away. Um, so that's kind of odd. So, after that initial doctor's appointment with my PCP. Um, like I said, the day after I started getting those symptoms, and um, really like the day after that, the symptoms were around a lot more, um, especially the numbness and tingling, but not so much in the left side of my head. I would only get that very rarely. But now, fast forward, let's see, well, for months I had, those symptoms, like constantly, really, except for, like I said, the numbness and tingling on the left side of my head, which would only very rarely come and go. So now I have like numbness and tingling pretty pretty bad in my hands and my forearms on both sides. The left foot is always the most numb and tingly. And back around, I want to say, beginning of November, this past year, 2011, I started to have cognitive problems. They call it cog fog. If you people who have MS, at least that's what they call it. I would have memory problems. Like, for instance, I went to one doctor's appointment. I think it was a cardiac doctor, heart doctor. And then, like, I went down the hall right after that to see the PCP doctor who I had an appointment with right after. So I'm sitting there in the doctor's office of my PCP doctor's office, and he said, well, how did the appointment go? And I was like, I don't remember. I don't remember what he said. I don't remember what happened in there. And I'm sitting there like for like 10 minutes trying to remember, and he's kind of looking at me funny, and I'm like, I don't know what to say. I don't know what to tell you. I can't remember. I don't know. And finally, after time, I started to remember bits and pieces of what he said. That was the first time that I really thought, okay, I've got something going on here cognitively, and it really kind of blew my mind. So then, like, little things would happen along those same lines. Like, I would forget people's names all the time. Um, I would, a couple of times, I couldn't remember my phone number. At one point, I couldn't remember what my neurologist's name was, even though I've known her for a year. When someone asked me, I mean, just things like this. And for a period of about 2 months, or maybe a little more than 2 months, it was fairly bad. Um, it was fairly bad, and confusion too would happen. I get confused kind of easily. Like I can remember things like eating like one of those um, microwave dinners, frozen dinners, and like reading this simple ass directions on the back, and then you know I turn around to put it in the microwave, and then I can't remember what the directions were, and I do that like probably 2 or 3 times in a row, and it's really frustrating. It's really frustrating. Um, so all kinds of things like that were going on. Um, also I've had like all kinds of other like little weird little symptoms. Like for instance, my left shin was like really painful, and but it was only painful to the touch. Like if you touched it, I would scream. But any other time, I couldn't feel any pain at all. There, weird. I know. I've also had sciatica on and off, which is really painful if you've ever had that. Let's see, what else? Man, it's just been kind of a long road with stuff in general with this. Dealing with the healthcare system, dealing with doctors who don't believe you um, because like for instance, the first round of testing that I went through an MRI, and I went through 1.5 lumbar puncture. I can get into that later about why it's 1.5, but um, basically the MRI came out showing 3 small lesions on the left side of my brain, which is the side that I'm having the most trouble with on my body, which kind of makes sense there. Um, and the lumbar puncture came back negative. Uh, what's happening is the doctors are looking, the uninformed doctors are looking at these tests, and like for instance, my primary care doctor says things like, well, you've only gone through one. I mean, no, I'm sorry. You went through a round of testing. The test came back negative, so you don't have MS. And I'm like, well, I'm thinking, how is it that I know more about the basics of MS than my doctor does? These are the things you have to deal with, because basically, if you have MS, there are some people who don't get diagnosed right away because this disease is very hard to diagnose. I know people who have gone for years with several rounds of testing who it took a long time for them to get diagnosed. Um, so, um, so I'm dealing with that, or trying to at least. Then I have 2 neurologists. One of them is a woman, and she uh, says things to me like, "Oh, you only have 3 lesions in your brain, and really you don't have MS because people with MS have 7 or 8 or 10 or whatever lesions in your brain." I mean, I've heard of people who have no lesions in their brain and have MS. You know, have a diagnosis of MS and have MS symptoms and have for a long time. Um, So, what does that tell me about my doctors? From what I understand, a lot of people who have MS have issues similar to this with doctors who don't seem to really know very much about this disease. So, my advice to you, anyone who's watching this, is to be your own advocate in every aspect of your care. Um, And one of the things that I've done is I was accepted into the local MS clinic, and I have an appointment there at the end of April. Um, my understanding is that they don't take new patients unless they feel like they can help in some way, or that another doctor has missed something. Um, So I kind of went back and told my doctors that, oops, I kind of went back and told my doctors that info, and they seemed a little bit surprised. And one of my neurologists, the woman neurologists, she's kind of giving me a little bit of attitude. Now the other neurologist that I'm seeing, or actually not really seeing anymore, because I kind of dumped his ass. But there was another neurologist that did like extensive kind of testing on me. Spent probably a good hour and a half, or maybe even more than that, doing different tests and stuff. And he was under the impression that all of my symptoms were as a result of a pinched nerve in my lower back, um, lower spine, which I have had for like 15 years. I got injured at work a long time ago, and I went through physical therapy, which didn't really help me very much. And eventually, the pain, the sciatica, and stuff like that went away. Um, and he was saying, I was saying, well, what about my cognitive problems and, you know, confusion and depression, as well as another problem I've been having. Um, and he was like, well, let's go for the Sunday to a sleep study. So I did that. That was a horrible experience. Um, and I really didn't sleep any at all, but anyways, the test came back and they said that I have sleep apnea. Yeah, big surprise, right? Okay. So, but I don't know. I mean, in talking with all you folks out there in the MS community, um, in great detail, especially with symptoms, common symptoms that I have um, with y'all. Uh, it doesn't feel like it fits to me. So I don't really buy that diagnosis.